In the second section of our lecture, now let's talk about the evaluation of the deaf child. In this section, we will talk about the finding the cause of deafness, and we will also talk about what are the risk factors that can lead to hearing loss, and then how we can assess the hearing loss in infants and children. So first, the evaluation of deaf child. Before the evaluation, it's very important that we should, as soon as possible after birth, if the diagnosis of deafness is made, the sooner the diagnosis and finding out that the child may have a problem in hearing, the sooner the treatment can be started and the approach of the children, we can start early approach for the development of language and speech in children who are hard of hearing. So first thing is development of suspicion. Suspicion is important. Think that your child might have problem in hearing if they sleep through or fail to startle to loud noises. If the children, they do not respond to loud noises and they keep sleeping and they do not startle when they hear loud noises, that's the first indication that there might be a problem with hearing. So the earlier the suspicious, the sooner the treatment begins and more chances that the child will end up having normal language and speech. And then other is if we do not evaluate, as I mentioned, there is failure in the development of speech. So hearing is very, very important factor. Speech and language cannot develop without proper hearing. Hearing is the method of learning the language and speech. Then what are some risk factors for hearing loss in children? Family history of hearing loss. If there is a family history of hearing loss, there are increased chances that the newborn have hearing loss also. So if it runs in the family, make sure complete evaluation of the newborn at birth should be performed. Prenatal infections, so family history, prenatal infections can lead to, it's another risk factor of hearing loss. Craniofacial abnormalities. Any craniofacial anomalies or abnormalities can lead to hearing loss. Then low birth weights, hyperbilirubinemia, we already mentioned, low birth weight, preterm deliveries, jaundice. In jaundice, it's hyperbilirubinemia. Bilirubin level is high and it can also be a risk factor. Bacterial meningitis, APGAR score. APGAR score is the measurement of movement, heart rate, breathing. All these are measured during the prenatal period, and if there is APGAR score is low, there are chances of deafness, and it's a risk factor for developing deafness. Then mechanical ventilation, if it's more than 5 days, usually it can lead to deafness. And stigma or finding associated with syndromes. So all these are the risk factors for deafness in children. And then we all mentioned before in detail that infections are very, very important cause of deafness, like viral infections like we have cytomegalovirus infection, then we have herpes infection. All these measles, mumps, can cause deafness if the mother is infected by all these infections. Then low birth is another very important cause for deafness. So all these are the risk factors associated with hearing loss in children. Then assessment of hearing in infants and children. There are some screening procedures, there are some tests. We have conditioning tests, we have objective tests, we have screening procedures that are used for the assessment of hearing in infants and children. So neonatal screening procedures, these include, we have ABR or auditory brain stem response or autoacoustic emissions. So this is a screening procedure for checking if the child is deaf or not. Then arousal test is another test, screening test. Auditory response cradle. Then we have some behavior observation audiometry tests. These include Morrow's reflex, cochleopalpebral reflex, and cessation reflex. Then another assessment method is distraction techniques, which from 6 to 18 months of age, usually distraction techniques are tried. Then we have conditioning techniques, which are from 7 months to 2 years. And then visual reinforcement audiometry, it's like a play audiometry is used. And then we have objective tests like auditory brainstem response. So all these are the different tests that are used for the assessment of hearing in infants and children. We have behavioral testing, we have distraction techniques, conditioning techniques, objective, different methods are used to find out whether the if a hearing of the child is affected, or if it's not fully complete deaf, then how much is the level of hearing loss. That helps later on for the management and different treatment options that can be used. So it's very important that child should be assessed properly with different tests to find out the level of hearing loss. Autoacoustic emissions also is another objective test. And impedance audiometry. So all these are objective tests. Here we have auditory brainstem response, autoacoustic emissions, and impedance audiometry objective test. Now let's talk about we mentioned already what are the different tests that can be used for assessment of hearing. So one by one, the screening procedures. We have arousal test. Arousal test is simple. It's a test that is performed to find out if the newborn wakes up or becomes alert as a result of sound that is or noise. That's the arousal test. If the newborn keeps on sleeping or they do not show any alertness after the noise, it means they are not hearing that sound properly. That's arousal test. Then there is a auditory response cradle. Auditory response cradle is again a simple test in which a cradle is fully automatic, and it's controlled by the microprocessor. And when the sound is induced into the child ear, and as a result of that computerized or automatic cradle, then it gives the reading of the recording how the child or the newborn is responding to that sound which is given to the ear. So it's a cradle, auditory response cradle. Then we have auto acoustic emissions. In this again, a probe is inserted, small probe into the ear, and then sound waves, sound is produced, small light tone sound is produced, and this can give the response of the newborn brain as a result of those sound waves. So again, very simple test. A child, even usually during the sleep also, this can be performed. Then auditory brainstem response, ABR, in which the electrodes are placed on the skull, and then the sound waves are transferred, and then the graph is recorded. That gives the also the different waves, 1, 2, 3, 4, 5, depending on which area it is recording, and then the waves are differentiated. So this is auditory brainstem response. Then behavior observation audiometry. This, as the name show, this test or these tests usually gives how the behavior of the child changes as a result of auditory signals presented to an infant. So it's the behavioral changes, observation in the behavioral changes. So auditory signal presented to an infant produces a change in behavior. Cessation reflex. Usually when an auditory signal is presented, cessation reflex is if the child is or infant is performing some activity. So there is usually a cessation of for some time. So because they want to pay attention which direction the sound or noise is coming. If there is no cessation reflex, again that indicates that there is hearing loss of some degree present. Then there is one Moro's reflex. Moro's reflex is a reflex again when usually the baby stretching out arm with the startle on suddenly released for an instant. If the child is released for an instant, usually that's a reflex that the child, they spread their hands, they lift their head, and that's called the Moro's reflex. This is also the reflex sometimes sound. When they startle as a result of sound, sudden sound, they present that like this with the hand going outwards, head up, and then that's the Moro's reflex. That's the other testing of the behavioral audiometry. Then there is cochleopalpebral reflex, as the name show, between the cochlea, which is in the inner ear labyrinth, and palpebral is in the eyeballs. Usually there is the contraction of the muscle orbicularis and then palpebrum muscle that can cause contraction as a result of the sound presented as auditory signal presented to the infant. So again, here we have these are the muscles: lateral rectus muscle of the eye, medial rectus, this, and then we have right. There is head rotation, right ear, left ear, and then there is contraction of the eyeball. So this is as a result of the sound. There is contraction of orbicularis palpebrium muscle that can cause contraction or shrinking of the eyeball. So it's another test performed. Then some distraction techniques in which usually this distraction technique is performed on children which are about 6 to 7 months old, and when they are performing some activity and noise is produce or sound is produced, usually it causes distraction of the child, and if their hearing is normal, naturally they can look back and try to find out from the direction from which the noise is coming. So that's the distraction technique. Distracting sounds from behind to check if the child locates it. So that was all about the assessment, in which we talked about different tests performed to do the assessment of hearing in infants and young children. Thank you for watching sqadia.com.